Hello, I am Dr. Hanume Gowda. Meniscus, also called the ring ligaments or a ring-like structure which are present inside the knee joint. They actually give the depth to the knee joint to give contouring for the femoral condyles. So the bone has got a different contour on the thigh and the bone of the leg has got different contour. This ring will help in giving the contour a proper alignment. Sometimes during high-end activities like high intensity activities, these meniscus can get injured. Like high sporting activities like twisting, turning, jumping type of activities, the meniscus can get injured. So once the meniscus gets injured, there's a lot of pain in the knee joint and sometimes people will get locking episodes. Locking episodes is the movement gets stopped completely or partially so that you can't do a certain movement beyond a level. Whenever there's a locking episode of the knee joint, the pain is very severe. Sometimes it can lead to a second fall because the joint doesn't move properly. So meniscus injuries are to be treated by surgery by and large. Sometimes we repair the meniscus, we put it back into position and we stitch it up. There are special stitches available that can be put inside the joint and stitched back. Sometimes some of the smaller ligament injuries, smaller meniscal injuries, the small part which is torn can be removed, which is called meniscus balancing. With that, you will get a good result. Meniscus injuries in older patients are by and large degenerative. Degeneration is as age advances, there will be a lot of wear and tear happening in the joint. Meniscus also goes into wear and tear. There will be small little tears. Sometimes they need surgery, sometimes they can be managed without any surgery by medications. So to summarize meniscus injury, younger patients with activity related injuries like sporting activity related injuries or fall related injuries, they will by and large need a surgery for meniscus, either to repair or remove a part of it or to stabilize it. And in older patients, most of the times we don't need a surgery to repair the meniscus. Minimally invasive knee surgery, also called arthroscopic knee surgeries, are done to treat joint problems inside the knee joint where some ligaments are injured or some sort of damage has happened which needs to be taken care of. So post surgery, the recovery sometimes takes a bit longer, like if you have a multiple ligament injury or a major ligament injury which has been repaired, you will take at least about 6 to 8 weeks to recover, of which depending on what sort of surgery has been done, your doctor will recommend 3 weeks of absolute rest or 6 weeks of absolute rest or minimum activities. So accordingly, you will have to maintain that particular strategy or whatever he has told you so that your recovery is according to a plan. In minimally invasive knee surgeries, the recovery is like, can I get up and walk? Yes, you can get up and walk on the same day, sometimes with braces, sometimes without braces, and going to toilet and doing normal small little activities like walking within the room is allowed on the first day itself. So movements and all will come a little bit later, like 2 weeks and 3 weeks, as I said, depending on what sort of surgery has been done. Minimal invasive surgeries involve 1 or 2, 3 holes which are put around your knee joint, and on that it is projected onto a camera. Through a camera it's projected onto a TV screen, and looking at the screen we operate. So the invasive, in the sense the amount of cutting of the tissues is very less, recovery is faster. That doesn't mean all surgeries are same. Some surgeries have got minimum activity inside the joint, they recover faster. Some people have a lot of activity inside the joint. When you operate, they recover a little bit slow. After a minimally invasive knee surgery, sometimes you will need crutches or a single stick or sometimes a walker, depending on the type of surgery that we have done. Recovery from knee replacement, usually we make the patient walk on the same day of the surgery or a day later, depending on how the patient tolerates and cooperates. Complete recovery will take about 3 months if at all it is both the joints. If it is a single joint replacement, both the joint means both knee joints, left and right, if replaced, will take about 3 months to get back to normal activities. To walk around, usually by end of a week, you will be comfortable to walk and go to the toilet and sit on a commode and do your hygiene situations by yourself without any support. If at all it is a single joint, within 1.5 months you will have complete activity because recovery is faster with single joint replacement.